Andy Slavitt. This past week, and particularly the past 24 hours, have been really interesting and I think value added to the issue of vaccine protection in the government attempt to contain this outbreak. In previous briefings, I had mentioned that the federal government had been involved in the development and/or facilitation of 3 separate platforms of vaccines. One was the mRNA, the other were vector, either an adenovector or a chimp vector, and the other was the soluble recombinant proteins. We all know now of the recent data that came with regard to Moderna and Pfizer with their mRNA showing a 94 to 95% efficacy and a very, very good efficacy against advanced or severe disease. Over the last 24 hours, there have been the announcements of 2 other trials that represent 2 additional platforms. One is the soluble protein platform in a study that came out of the UK using from the company Novavax, and the other one that we discussed this morning at a press conference at the NIH was the Janssen or Johnson & Johnson Adeno 26 trial that took place in the United States, in South Africa, and in Brazil. And the results really are very encouraging. Let me just very briefly outline for them for you, and then maybe make a couple of comments regarding nuances of the study. In the study that was just reported by Janssen, Johnson & Johnson, it was a trial using their Ad26, and the overall vaccine efficacy in the study was 66%, but for the United States, it was 72%. Now, the important issue, because the first thing people do is compare a 72% efficacy with the previously reported and other trials of 94 to 95%. That is true, but when one looks at the potential impact on a very important aspect of what we look at carefully, is namely severe disease, that overall in the United States, in South Africa, and in Brazil, the overall efficacy for severe disease was 85%. And in fact, in the study, including in the South African isolate, there were essentially no hospitalizations or deaths in the vaccine group, whereas in the placebo group, there were. So this really tells us that we have now a value-added additional vaccine candidate that will, of course, as happens with every candidate, will present the details of their data to the FDA. But I want to point out that this has important potential and real implications, both domestically and globally, because as many of you are aware of, this is a single shot vaccine in which you start to see efficacy anywhere from 7 to 10 days following the first and only shot. It is very, very good with regard to cold chain requirements, namely requiring only a refrigerator. It is inexpensive, and the company is capable of making doses in the numbers of billions. Of note, and this is something that relates to what Dr. Walensky just said, we are being faced with variants. We're all aware of the variants that we knew dominated in the UK, the 117, the 351 in South Africa, and other variants such as the P1 in Brazil. When these variants were first recognized, it became clear that we had to look at in vitro, in the test tube, whether the antibodies that were induced by the vaccines that we had available would actually neutralize these new mutants. And it was reported in several preprint journals over the past couple of weeks that although it diminished, particularly the troublesome South African isolate, although it diminished the efficacy of the antibodies, it still was not below the cutoff where you would expect some degree of efficacy. But what we know now from this study, namely the J&J and the Novavax study, that antigenic variation, i.e. mutations that lead to different lineage, do have clinical consequences. Because as you can see, even though the long-range effect in the sense of severe disease is still handled reasonably well by the vaccines, this is a wake-up call to all of us that we will be dealing as the virus uses its devices to evade pressure, particularly immunological pressure, that we will continue to see the evolution of mutants. So that means that we, as a government, the companies, all of us that are in this together, will have to be nimble to be able to just adjust readily to make versions of the vaccine that actually are specifically directed towards whatever mutation is actually prevalent at any given time. And finally, this all tells us that it is an incentive to do what we've been saying all along, to vaccinate as many people as we can, as quickly as we possibly can, because mutations occur, because the virus has a playing field, as it were, to mutate. If you stop that and stop the replication, viruses cannot mutate if they don't replicate. And that's the reason to continue to do what we're doing, namely intensify our ability and our implementation to vaccinate as many people as possible, as quickly as possible. So now I'll hand it back to Andy Slatman. Andy?